So good evening, everybody, and you're all really very welcome to join us here this evening for the 21st in the series of Let's Talk Equine Webinars. Really delighted to have you all here, no matter where you're joining us from. Just to introduce myself to those who may not know me, my name is Wendy Conlon. I'm an equine specialist with Teagasc. And I have with me here this evening Carmel Welsh from Kilcash Equine Clinic and Jennie Henderson, who is resident vet at Ballylinch Stud. So you're welcome, ladies, and thank you very much for joining us here this evening.
Thank you for having us.
Very welcome, you're very welcome. So look, before we get going, a little bit of housekeeping. This webinar is being recorded, and the intention, of course, as usual, is to share it on www.teagasc.ie /Let's Talk Equine in the coming days. That is, of course, with the technology obliging, as I always say. And viewers here this evening are most welcome to input their questions throughout the evening. You can do that using the Q&A tab that you should find on your Zoom screen. They're usually found when you hover over the bottom of your screen. So, like I say, Jennie and Carmel are here with us this evening. And just to introduce you both to those who may not be familiar with you, Jennie graduated from Liverpool University back in 2002. She worked in stud practice in the UK and Australia before joining Kildangan Stud for 3 seasons, and then back across to Newmarket Equine Hospital, where she spent 7 years running the neonatal intensive care service there. She's now a resident vet, as I mentioned, at Ballylinch Stud. And Carmel then graduated from the University of Edinburgh back in 2009. She spent a season in Western Australia, followed by 6 years doing stud practice in the UK, and joined Kilcash Equine Clinic in 2016, where she's now a partner. And her main interest is in mare and foal medicine, including advanced reproductive techniques. So very well qualified, both of you, for the subject that we have this evening, which is to discuss the management of foals from the time they are born through to weaning. And I suppose, some of the issues that can arise during that period, and most importantly, to balance against that, the kind of tips and management practices that will help. They don't always, prevent every situation, but they certainly help in reducing the amount of instances that may occur with foals during this age period. So, I'm delighted to be able to engage in that discussion with both of you here this evening. And maybe, Carmel, to begin, while you're getting set up there with a screen share with your presentation, if I come to Jennie first. Jennie, just tell us a little bit about what your job entails at Ballylinch, and even just to put people in mind of, I suppose, put in context the number of mares that you foal there in a season, and what your job entails there.
Sure. So I live on the farm, and there are a lot of staff also living on the farm. So I'm one of the team living and working there, so 24/7. Especially at this time of year. We foaled about 139 mares, I think last year, slightly more than usual last year, perhaps because of Brexit and more coming to board. We usually probably around 120. So it's about 30 foals on the ground so far. Probably a few more by tomorrow morning. But a busy time of year for all of us. And yeah, we're in sort of fairly rural location, so it is good to be based on the farm, and we have our own lab and things there, so we can do, because we're quite far from some hospitals. So we do a lot of everything we can on the farm, and we're supported by some other practices around, like referral hospitals and Clinic Nigopol as well for some teaching. So So
it would be fair to say, that your experience in the sense of all the various issues that can occur, and particularly given your time in the neonatal side of things over in the UK, you've seen all the pluses and minuses that happen during that age period.
Yes, I think, and having, I think, the experience of dealing with things out on the farm and in the hospital, and sometimes sort of combining a bit of both of those, what you can bring out to the farm and what you really need to take into the hospital. I think, it's good to have seen both sides of that, and worked in different countries as well.
And Carmel, of course, Kilcash Equine Clinic, you have a widespread clientele there as well, and it cuts across sport horses and thoroughbreds. So maybe just tell us a little bit about what you're at on a day-to-day as well.
Yeah, so I'd basically be very much the ambulatory vet. We try not, if we can get away with it, not have foals in the clinic, because we believe you need a bigger team once they are that ill that require a clinic environment. But yeah, so mares, foals and everything in between as far as what we deal with out on the road. And then depending on either the experience or otherwise of the studs that I'd be dealing with, I deal with multiple larger studs that'll have several, 20, 30, 40 foalings in a year, right down to somebody with their pony foaling one mare, So you need to, all of this today hopefully will give everyone the experience as far as just to know the main things as far as what's normal and what's not. Nobody's expecting you to turn into a vet after an hour's 60 minutes here, but knowing what is not normal is going to be what's most vital. And if it's not normal, you either get us on board or on the phone and kind of go, I think I have this, what should I do? And just knowing when to call us can absolutely save the life of a foal, towards thinking 4 days later, maybe I should have called the vet. So yeah, that's basically what tonight is about, is kind of, we've split it up a little bit between what's normal and what you should expect to see for those who either might be foaling their first mare or haven't seen a foaling or anything else, right through to obviously I say the weird and wonderfuls, but the things we would come across commonly from either youngsters, neonates, right up to older foals.
Listen, you have the presentation up, so I'll let you throw it up into full screen mode there, Jennie, and yeah, you can kick off and take us through it.
Thanks, Wendy. See that on full screen?
Yeah, can see that.
Okay. So yeah, so thank you for inviting us both, and it's good really to be joined by a big audience and talk through what we both do on a daily basis, and what I'm sure probably a lot of people in the audience are busy or about to become busy doing as well. So yeah, hopefully we can have share some ideas as well, and get you asking questions and commenting and sharing your experience as well as we go through. So I think certainly trying to get your mare in the best possible shape before she has the foal, sort of going back really a few months from where we're actually at now at this time of year. But I think that's really important, to keep your mares in good shape and just as little stress as possible. So good feeding, no nutritional stress, looking after their feet if they're sore or lame, seem harder to get around, especially when they're heavily pregnant, mares that have had laminitis and things. So farriery, good feeding, just really looking after the basics well, I think can get your mare in good shape, getting her teeth done once or twice a year, making sure that your parasite control is good. And then I think one thing we find particularly important, being on a large farm and having mares sort of coming to board and with us and visiting us, is to try and have them in nice settled groups, so there's no stress of who's the bully or sorting out the pecking order. So we try to keep them in those small groups so they know each other, they come into the foaling unit with a friend, and just keeping everything as stress-free for them as possible. And then you can see in Carmel's nice picture here, a lovely deep fresh bed, clean straw, and then we call this a period of tranquility when the mare has just foaled. So again, just not diving in and disturbing her unless she really needs your help. So just being aware of kind of what's normal, perfectly normal, and a good thing for a mare to lie still for a few minutes after foaling, so all the blood can be transferred through the umbilical cord into the foal. That gives the foal about an extra 10% of its blood volume. So yeah, aiming for a nice sort of quiet, peaceful foaling process. I know it doesn't always go like that, and it's good to be on hand to help when it doesn't, but if everything's going right, then just leave them to it. I think hygiene is really important at foaling, whatever sort of size of stud you are. Obviously, if you are a bigger farm and you've got lots of different mares coming in and sort of turnover foals, they're really completely emptying and disinfecting your foaling box, allowing it to dry, and then nice deep clean bed. It's quite a lot of work to muck out a big deep box, but I think that really is worth it to give these foals the best possible start and the least risk of picking up an infection when they're in that really vulnerable sort of first few hours before they've absorbed their colostrum, when they're still kind of down on the ground, they're searching for the teat, they might maybe licking on the walls or the wrong things. So just having everything really clean, and good beds, nice clean stables, and just simple things like we have foot dip outside the foaling box. Everybody dips their feet before they come into the foaling area if they might have been out and about around older foals, wearing gloves to dip the umbilicus. Just quite simple things, but really important, and we can really make a difference, stopping them picking up infections early. And then see the next thing, colostrum is also vitally important for preventing infections. So we just say a colostrometer, which is a little meter that you can buy, is a really good way to measure colostrum and give you an idea of how good a quality that is. But if you haven't got a colostrometer, I'd say a good sort of rule of thumb is that good quality colostrum will look like nice thick custard, or maybe the kind you used to get for school dinners that perhaps wasn't that nice to eat, but thick and chunky is good quality colostrum. If it looks watery and like milk, then it's probably sort of down on the 15% or lower, and that pretty much is milk. There's not going to be a lot of antibodies in that to give to that foal. So again, we're lucky being on a big stud that we have lots of normal mares with good colostrum, so we take the opportunity to freeze and bank sort of between 250 and 400 mils. We don't take it from maidens because they tend to have a bit less, but a mare that's had several foals, has plenty of good quality colostrum, we'll get some from her and freeze it for the following year. Between sort of about 20 and 25%, that's usually fine for her own foal, but we don't tend to store it. If it's less than 20%, we usually try to give them 1 bottle of donor colostrum, because that would be a bit borderline otherwise with their antibody levels. And if it's lower than 15%, then they're quite likely to have inadequate levels of antibodies, so they ideally do need some donor. So if you have enough mares foaling, then do try and start your own bank, or if you've only got 1 or 2, then maybe if your mare is running milk before she foals, perhaps ask around and see if some of the big studs might lend you some. So if you have a colostrometer, you can test the colostrum as soon as the foal's born, so you know what it's drinking, and say if not, you can have a pretty good guess from what it looks like. And also, if you know your mare has been dripping colostrum down her legs for the last week before foaling, it's pretty likely that there's not going to be many antibodies, unfortunately, left in that for the foal. They're all on the floor, so you can have a good idea of which foals are going to be at risk. So roughly they need about 1 litre of good colostrum. If it's sort of poorer quality, maybe 2 litres. And we actually give a bottle to all of our foals as soon as they're born to get them off to a good start, make sure that they get that colostrum into them before they're up and about and maybe sort of sucking on the mare's legs or looking. We like to have that sort of lining their intestines. We find that they take the bottle really well when they're just or before they've even stood up. So if the mare has good colostrum, we'll wash her udder, milk her, and give the bottle to the foal. If it's poor, then we'll thaw a bottle of donor, and we find that gives them a good start. Don't have issues with low antibody levels very often. So just one thing I say about bottle feeding: if the foal won't take the bottle well or has a poor suck reflex, then it's really important not to try to tip the bottle into them, because you can get much more serious problems if they inhale some of that milk. So only bottle feed a foal that has a really strong tongue curl, that if it can latch onto your finger and suck hard on your finger and latch onto the bottle. teat well, and again make sure the teats, that the hole in the end of the teat isn't too big, and that you're not sort of drowning the foal with the colostrum. So, and if you're having any trouble getting a foal to either nurse from the mare or take a bottle, then there's always the option to get your vet to come out and stomach tube, so bear that in mind. So the next thing after foal's arrived and we've checked her colostrum, once the cord has broken, we always dip the umbilicus. We would usually go on dipping it a couple of times a day for the first 48 hours, and occasionally a little bit longer if it's still moist. But our preferred option is 0.5% chlorhexidine solution, so that's the pink one, fairly dilute. Iodine is also used quite commonly, and some people like iodine partly because you can see that it's been dipped and it's clear to everyone that you've remembered to do it, and it can dry them up a little bit more quickly. Just be careful that you don't use iodine that's too strong, because that can cause the umbilical stump to break off, and occasionally that can even the foal can start to urinate through it. I have seen that as a problem when people are using 10% iodine, so which I know people use for calves and lambs and things, and they don't seem to get that problem. So if you're buying your iodine from the farm shop, just be aware, do dilute it for your foals. We use a spray bottle, or you can use disposable cups, so maybe now we try not to use so much single-use plastic. Perhaps a spray bottle is better. But I did have one farm who were getting a bit of a run of problems with umbilical infections, and I said to them, well, you do use a different cup in between foals, don't they? And they said, no, we've had the same one for the last 10 years. So we threw that in the bin and miraculously solved the problem. So yeah, but a spray works well, and it doesn't go all over the foal. And we'll talk a bit more about treating infections later on. And we can, unfortunately, in thoroughbreds, I almost forgot to mention scrotal hernias, because we don't see a huge number compared to when I worked in Australia with standardbreds. And so this is Carmel's photo, but yeah, at the same time as checking for umbilical hernias, and it's also
absolutely. If you think that your foal is extremely well endowed and seem to be quite proud of that fact, potentially give us a buzz. It definitely is more common in the half-breds than the thoroughbreds, and usually just reducing it constantly over the first 24-48 hours will actually solve the problem. Towards this foal was actually presented to me much later for a separate issue, and then we realized it had a scrotal hernia, you know what I mean, and required surgery and stuff. So yeah, if you spot them in the first couple of days, often just popping them back up onto the inguinal ring obviously closes down a little bit and helps us out. Some of them will need to go for surgery, but it's way better to get that done sooner rather than later, as opposed to wait till guts are down there and things tend to go pear-shaped quickly.
Yeah, look out for those as well. So then hopefully now your foal's up and found the teat and nursing, and in around the same sort of time frame. So we usually say sort of 3 hours to be up and sucking max, and hopefully also the placenta is out. So I was actually just going through this with a couple of our younger staff today. Let's get the video to play. So we collect the placentas into a bucket, and the staff check them at the time, and the foaling staff. But why is the video not playing? There we go. Yeah, I'll always check them again in the morning. But this is again something that you can do yourself. And we actually had a mare last night where the tip piece of the non-pregnant horn here was missing, so it was important that we found that knew about that in the first few hours. The staff had said to me, oh, it's torn, and we'll double check, and so we've been flushing her and retrieving that and have her on treatment. So if you leave a piece of placenta in the mare, she can get really, really sick, even if it's just a small piece. So you can see here we're laying it out. This is the non-pregnant horn, the chunkier, sorry, this is pregnant horn, the thicker, chunkier one, and then the non-pregnant horn, the little flimsy bit. And then I always turn them inside out then as well, and look at the look at the velvety red surface, and you can sometimes see if there's any discoloured areas or sort of thickened areas that you're worried about. So they can be a bit tangled, but yeah, if you basically stretch out each piece as far as it will go and lay them all out. So this is a cervical star, the bit that the foal pushes its legs and head through. This is the body where the foal's been sitting, and the pregnant horn, and then we've got the tip of the thinner non-pregnant horn, and this is often the bit that's missing. I think the next slide has a and then the umbilical cord here, and then this is the amnion, so the white shiny sac that's wrapped around the foal.
But you can't stress enough how important it is to do this, and to do it well and thoroughly, and take the time to do it thoroughly.
Yeah, and so the mare this morning, the piece was missing, but because we found that straight away, she's fine and she's been treated. And yeah, you can see here on this one that there's that tip instead of a nice rounded shaped tip to here. So this is a cervical star. So this is a hole that it's meant to be where the foals come out of, but this should be a rounded end, and it's not. That piece is missing, and whenever you see that piece is torn, it's almost certainly going to be in the mare. Don't let the dogs get at them before you or the vet have checked them. It's going to be a bit hard to interpret.
Yeah.
So other problems that you might pick up from the placenta, you can see that this one is really thick and sort of cheesy looking, and that is a case of what we call ascending placentitis, so where the infection has got in through the mare's vulva and then through the cervix, and has affected the placenta, and then can cause some inflammation in the foal, and the foal but this placenta belonged to was actually a mild dummy foal. So we'll talk a bit more about those later on. And then the other thing you might see is a red bag delivery when the whole placenta is separated and coming away with the foal. And the reason that is a problem is because the foal's no longer getting attached inside the mare, and it's not getting oxygen anymore during the delivery if the placenta is coming with it. So sometimes if the delivery is very quick and the placenta is separated, the foal might be okay, but if it's taken a bit longer and it's been deprived of oxygen before it comes out, then again you might get problems. So I always get the staff to ring me if they see this, and we'll have that foal on sort of high alert.
Just on that point, it's great when you have a Jennie on site, but if you see this, don't ring me. Open it, get the foal out, then ring me. Basically, the foal is being starved of oxygen at this point in time. Everything has detached from inside the mare, basically. So, and it's trying to come in the whole bag. So slice that open with whatever, hopefully a lovely clean scissors that you have in your newly found foaling pack, but yeah, whatever you can get your hands on, open that, get the foal out. They usually foal quite easily as far as that's concerned, as dramatic as the start of this is, and get them out, and then you call me or otherwise call your vet, basically, to assess the situation after that. But get them out is the number one priority.
Yeah, and yeah, so our staff would cut the bag as well as calling me. Yeah, so even though I'm on site, it still takes me kind of 5 minutes to get to the foaling unit.
And if you find you do have an ugly looking placenta, or you're not quite sure of the placenta, basically, absolutely keeping it for us to examine it fully in the morning, either taking a picture of it and going, what do you think of this? But if it doesn't look normal, the fact that placenta is all out and all there, that's wonderful, but oftentimes it can give you clues and tips that you will need to treat the foal. So the foal may look fine and up and doing everything else, but there may well be infection. If the placenta was infected, the foal is infected, and you won't see that issue until 3 or 4 days down the line, where it begins to get very sick. But if you spot that, Andrea, one of my colleagues, had a case like that last year, I think it was, and like there was very much yellow, nearly pus within the placenta, and thankfully the guys there spotted it and flagged it straight away, and yeah, the foal was treated and all was prevented. It is way cheaper. I know you don't like getting us in for stuff, but it's way cheaper to get us in 2 days before a problem than 2 days after.
Yeah. And likewise, I always say I'd rather deal with these sorts of problems, and the same with retained placentas or foals that haven't sucked in time, and as soon as possible, even if that means getting up extra early in the morning, because often if you leave it until kind of the regular day of start of day, everybody's really busy already, but also that falls a few hours behind where it should be, and the more hours behind they get, the harder they are to kind of turn around. So yes, I suppose just to summarize that, really, this is our sort of checklist that we both give to clients, that the first few minutes after being born, they should be sitting up, shivering. That suck reflex should be there. If you put your nice clean gloved finger in their mouth, they should latch on and have a nice curled tongue and be ready to suck. And then straight away sort of putting their legs up, making efforts to get up. And then most foals are up within an hour. I know a few take a little bit longer, and sometimes big sort of dozy colts and ones with maybe slightly slack pasterns and things might need a little bit more help, but ideally within 2 hours up and sucking. And we always give an enema, and I think a lot of your clients,
I advise all my clients, for the sake of whatever an enema costs, 3 or 4 quid now, it is for the 1 in 100 or otherwise that will actually do a meconium impaction or have an issue with it. It is way cheaper, again, to spend your 3 or 4 quid on every foal than it ever is to get us in for trying to, or to do surgery on a foal for a meconium impaction. Most of them, thank God, can be treated medically, but you don't want that one that can't.
Yeah, so that's sort of the 1, 2, 3, getting us through the first 3 hours, isn't it? So hopefully the foal manages. Perfect.
That's what it's all about, isn't it? Yeah.
This was my first attempt. I haven't already tried 4 times before I did it. It's nice to hear that.
And if you can, I know everyone at 2, 3, whatever time in the morning is quite keen to get them up and get them under and get them sucking and stuff like that. But if you can let them make a few decent efforts themselves, it really is vital for those first muscles to actually make sure that they know they can get up themselves. And yes, absolutely, if they're struggling, but I don't think every foal needs everybody in hauling it up off the ground within 10 minutes just because we want to get back to bed.
Before you move on to the next section, ladies, what I might do is just pop a couple of questions at you here that have come in. So there's one question in here: if your mare is running milk before foaling, should you try to milk her and freeze it if the mother, the dam herself, is actually leaking milk?
Generally advised not to, because if you start milking them, they'll just start spraying it more. If you think she's close, as in she's going to go later that evening, and you know what I mean, you can get a refractometer or a colostrometer. A little hint, I'm not sure I'm allowed to mention Google on here or Amazon on here basically, but a refractometer for beer, so that for sugars, can be found on Amazon basically for quite cheap, and will give you at least a better indication of where you're going with saving it. But generally it's not advisable to milk them. If it's literally she looks like she's about to go and she's starting to spray everywhere, collect it, test it, and if it's good enough, pop it in a bottle, you know what I mean, and hopefully if the foal is born, that could be the first bottle you give. But those mares that actually start dribbling days before they're going to do anything, it's not advisable.
Yeah, we probably more use it as a warning to see if you can find some alternative to have in your freezer ready for that night if you can.
Yeah.
Another question in is, what's the best way to dilute the 10% iodine?
We just dilute it. We get distilled water from the chemist, but I think you can realistically use bottled water as well. It'd be clean, or standard tap water, just not kind of barn water from the unknown quantity kind of or whatever.
Yeah, either boiled
Yeah.
water inside your, obviously boiled cooled water, or otherwise to dilute it and just dilute it down. Then either pour half out and dilute appropriately that way, you know what I mean, and you'll get it down to the right levels.
Another question then is, when foaling, should you let the waters break naturally always?
Not necessarily. It's a bit more difficult coming from a vet's perspective, because if we're there and the waters are there, we're breaking them in order to check position, so foal, feet and nose. But absolutely, if you're looking at a whole foaling taking 20 to 25 minutes, if there's no progression, that's when you help. So if every 5 minutes something else hasn't happened or popped out, that's when you go in and help. I'm not advocating everyone shove their hands up the back end of a mare the minute she sweats up on the neck or something. But if she has the amniotic sac out behind and it's sitting there for 10 minutes and there's no sign of a foot or no sign of something else behind it, then I would break that bag and have a feel, you know what I mean, as far as feet or nose. If feet and nose are there, leave her to it. But yeah, I would generally break it if there hasn't been progression after the first few minutes.
I'll give one more question for the minute and we'll come back then with some of the rest of them later on. Are you panicking if a mare is holding placenta for more than 3 hours?
What we usually do is at 3 hours, if she hasn't passed it, make sure it's sort of tied up so that she's not walking on it or tearing it off, because if she tears it, then she doesn't have that weight to try and bring it out. So we would wrap it up, tie it up with a piece of baler twine. Don't tie heavy weights on it, because all that happens then is you can actually, it tears and pulls out of her and it leaves a piece behind. And what you can talk to your own vets sort of about, but we would usually give them a ml of oxytocin at that point, which can often help them then to release, to contract the uterus and drop the placenta. If it stays in beyond sort of 6 hours, then you would usually get clients to ring me and we'd flush the mare, then see if we can get it out. But also beyond 6 hours, you usually put them on some antibiotics and anti-inflammatories. Some people might wait a little bit longer, maybe 8, but I have had mares where it's been retained for as early as sort of 6 hours, actually then get metritis and laminitis, which you really don't want, because that's a huge deal and can even be fatal. So yeah, I'd encourage sort of within 3 hours start to get a bit proactive. So tying it up, maybe some oxytocin if you've got that available, and 6 hours, then you probably need to up the ante a bit more with antibiotics and flushing and things like that.
Super.
So this is our sort of red flag list, really, of foals needing urgent attention. And we thought, potentially. So Carmel's going to go through these.
So if you see a foal that is meconium stained, so this picture, I don't know whether the color will show up the same basically, but if it's yellow staining, or there's like this yellow or green staining within the placenta, or shortly afterwards, or any, like the white legs on a foal or any white markings on a foal help, but sometimes just running your hands over the foal, you'll see it on your own hand if it's a black foal. And if they're meconium stained, they've definitely been stress coming out, more than likely inhaled some of that, because they've obviously defecated within the amnion. And that is important definitely to flag to us the next morning. It's not necessarily an immediate 2 o'clock in the morning scenario, but it definitely, that foal would need seeing the following morning for treatment. Obviously, and most of you would always call us if they're unable to stand for some reason, now be it for this image on the right hand side where they've either got a flexural deformity or otherwise, as far as that's concerned, and just physically can't hold themselves up, or if they're incredibly ill, like these other 2 little guys. And these guys on the left probably won't have a suck reflex for whatever reason. So if they can't suck, like Jennie was saying earlier, there's absolutely no point trying to pour milk down its throat. You'll definitely make things worse. towards the guy on the right hand side with a leg issue will absolutely be able to suck. So you'll definitely be able to either help support him or get bottles of milk into him fairly quickly, or colostrum into him fairly quickly. But if they are unable, they are definitely ones where you need to give us a buzz to give you a hand and best advice. Ideally, hopefully in most cases now, we have either the colostrum into the foal or otherwise, but is that the video?
Oh. Yeah.
That might be the next one.
Oh, no, I think it's the same foal.
Yeah. So if they haven't got the antibodies, basically, so if they haven't got the colostrum on time, there's a few things you can do. Hopefully having either a colostral bank, or knowing either between neighbours and otherwise a little bunch of you with horses, it's very sensible. Even if you're able to save some this year, you can freeze it and have it for the year. It can either do your mare or foal next year, or it's very handy to have for a neighbour, or if everybody's on WhatsApp groups now, basically, but to set something like that up that somebody knows that they can be able to access it. There is got the milk colostrum, the powder colostrum available. But if you know the mare has spewed out all her colostrum over the last week, you haven't been able to find any other colostrum to supplement your foal, and now the foal is 24 hours old, and you've remembered that it's really important, they should have had colostrum, but they haven't, I would definitely advise not then getting any of these powdered colostrums. They will need plasma, simple as, you know what I mean? They absolutely need plasma at that stage. They stop absorbing it through the gut. Generally, I would say be 12 to 18 hours, but definitely by 24 hours, they've stopped absorbing anything useful as far as that's concerned through the gut. There has been a few cases, myself and Jennie have both come across, we were chatting about this, where the powdered colostrum has been given, it didn't bring up the antibodies to the appropriate level, and then plasma was topped up on top of that, and either there's sudden death on foals or very bad reactions, basically, where you therefore have to stop giving the plasma, which is an extremely expensive 300 bag of gold to throw away. So if you think it needs plasma, again, that is definitely your cheaper option. As expensive as giving plasma is, having a foal come down with every infection physically possible and eventually die of something is the only other way it's going to go, basically. So getting your foal tested IgG wise, if you've any worries whatsoever, and I realize most of them, and thank God, that's I suppose why we're having this talk. Thank God the majority of them do it themselves and behave, and everything works absolutely fine. But it's really important to know what to do when it doesn't happen. So you may have come across, or some of you may have unfortunately come across this, so where the foals are very jaundiced, or they get this condition called NI, or neonatal isoerythrolysis. There is very little you can do when you realize this is your first time coming across this condition as far as that's concerned. There's blood transfusions required, and it gets fairly serious fairly quickly. But when you know you have a mare that has done this, it's all about the prevention for the following year. So you can also test a mare if you, for whatever reason, are worried about it. Usually people that have obviously come across this before then start testing mares, and of course they'll never come across another one, but absolutely, if you have any worries, you can test. But the main thing, if you know you've had one of these from your mares before, is to muzzle the foal at birth. So this is the one time where we'll be reiterating to you to not give the foal that mare's colostrum. Provide the donor colostrum, which hopefully you've already saved from previous mares or otherwise, and milk replacer then for the first 24 hours. This is again the case where you'll need to milk the mare for God's sake, do not keep the colostrum.
Not good for any foal, not just
do not give it to anything, basically. So that is one where you can milk it and leave it on the ground. Yeah, like it says on the screen here, it is possible to actually screen them in late pregnancy and cross-match at birth if you were worried one way or the other. And most of these will then, it's a painful 24 hours trying to make sure that the foal keeps a muzzle on and that you're feeding and everything else. But usually once you release the hound, basically, they're quite happy to latch on to mum and crack on with things as normal. And then you're fine once that gut has closed and it's no longer absorbing through the gut wall.
Yeah, definitely prevention better than trying to cure it.
That is most definitely
treat and transfuse some very sick foals with that, and we don't save them all. So yeah.
And so if you're struggling, you can definitely find a goat. That is the best milk you can find for a foal. But if you're not willing to stand there all day holding your goat, goat's milk warmed up obviously is perfectly fine. Semi-skimmed milk with 2 teaspoons full of honey. So you need that dextrose basically, as far as that's concerned, or you need that sugar within the milk. Where are we? And if it all kind of goes very wrong for whatever reason, so you can require fostering for rejection reasons. And that usually is associated with pain and stress. An awful lot of the time it's maiden mares. I generally advise my clients to have both bute and settling available, and as soon as a maiden mare has foaled, to at least give her a sachet of bute and some settling, depending on if they are very highly strong or otherwise. If they look like they're getting on with the mothering thing, absolutely fine, great. But an awful lot of them, it's mainly they'll be fine when the foal is on the ground, but once the foal starts sucking, they tend to get the hit of oxytocin from the foal sucking. That obviously sends the uterus into a bit of a flutter, which cannot be pleasant. And then whilst you have a foal fumbling around on new little teats, basically, also potentially not pleasant, can just make them get very sore and angry, basically. Most horses aren't aggressive. Unless there's a pain issue. So if you can get through that, or you're worried about that issue, definitely have bute and settling with you and ready to go. But if it's really not working, or the mare is getting particularly nasty, or you don't have enough staff or hours in the day as far as to either stay with them or sleep, you need to swap to a foster quickly. There is no point still going on. Like, you can't give out to a maiden mare as far as start hitting her or otherwise, you know what I mean? Hopefully, if we get on board one good slug of sedation and a bit of settling to continue on throughout the day for the anti-anxiety effect, usually will work quite well. But if a mare is just getting nastier and nastier, and you two are having to get more restraint involved, then she's not going to take it, and she's going to give that foal one almighty kick, and either break a leg or otherwise, or injure people. So if it's really not progressing well, foster quickly. And again, that is definitely your cheaper option, unless you want to find a goat. That is potentially cheaper. And obviously, if the loss of a mare. Now, if a mare does die at foaling or shortly after foaling, that is again a very good time to get that colostrum from that mare. It's a horrible time and everyone's extremely upset, but that foal needs colostrum, so milk the mare for all it's worth. If we're called out on scene, which obviously we usually would be in those scenarios, be it a bad foaling or otherwise, we can sedate the mare, depending on what is going on, sedate the mare, give her some oxytocin, milk the mare, try get as much as we can off her before if we have to euthanize or whatever the scenario is. But it's something that people don't necessarily think of, because it still will be several hours, especially if it's the middle of the night, before you get a foster mare available. And knowing where to find goat's milk is always handy. I do have, usually myself at home, have a goat's milk, and it does freeze. So you can have one of those, just get them in the little 1 litre or even the 500 ml and have them in the freezer, and at least it'll get you out of a hole till sometime in the morning. Right. And this little guy, often when you do, so he was fostered on February last year. And when you first let these mares out, obviously they are phenomenal mares, and I think they do an absolutely incredible job. But when you first let them out, they can be so keen to find grass that you just don't want them buggering off and the foal not figuring out that this is what it's meant to do and circle around mom and figure things out. So often keeping not just, this is obviously a couple of days after they've been together and everybody's happy with things in the box. But once you do first let them out, it's very important to stick around as well, because often these mares, if they see another foal in a different paddock or something else like that, they literally adopt anything, God bless them. Yeah, keeping your foal safe once you get to that stage. And as long as you're absolutely happy with that, that's the main thing. Right.
Yeah, so moving on to umbilical problems, and we've talked a little bit about these when we first talked about dipping the umbilicus. So yeah, just to reiterate, making sure your iodine is not too strong. And we mentioned hernias and talked about scrotal hernias as well. Most of these umbilical hernias, if they're about three of your fingers in size, your vet can treat them with rubber bands when the foal's a little bit older. So I wouldn't be too worried about noticing a little hernia when the foal is just born. Infections, however, are very take much more seriously, because having a little nidus of infection here in a foal of this age can be then spread bacteria through the bloodstream, and what can happen then is that you end up with an infected joint or a generally sort of septic, systemically unwell foal. So you do, just for the first couple of weeks, just every day when you're checking and feeding the mare, check underneath the foal, just have a look at that umbilicus, make sure it's not sort of swollen or any discharge, and especially at the stage where the umbilical stalk kind of starts to break off. That can be another risk time, even if it's been okay for the first few days. And we mentioned about the strong iodine, and sometimes just anyway foals that have maybe had a little bit of difficulty getting up, or perhaps straining due to a bit of meconium, can start to urinate through the umbilical stump. So if you notice that the foal's belly is a bit wet, or if you see it having a pee and notice that there's 2 streams of urine coming out, one from underneath it and one from where it's meant to come from, then again, let your vet know, because those foals do need some treatment. So then we've sort of already talked about a couple of reasons why foals can be dummy, or neonatal maladjustment syndrome. Lots of different names for the same condition. Wandering foal was one of the more old-fashioned names, and I think that's quite a good description, as demonstrated by this one. This one's not a particularly unwell foal, but it just really doesn't have any affinity for the mare, isn't really sure what to do. It would rather stand in the corner than go up to its mum. And you can see this foal's got a little feeding tube which we've stitched into its nose, and it's had some fluids as well, but we can feed and support that foal until it sort of figures out what to do. But and so, yeah, so we talked about some of the reasons being a difficult foaling or a red bag delivery. A lot of people may have come across the squeezing technique. I know that's quite widely discussed now. There was actually an article, I think, in the Racing Post just the last few days talking about it. So Professor Madigan is a very clever, both vet and I think stock person in California, Davis, had sort of noticed this syndrome, done a lot of work on this syndrome in foals, and in some cases we think the foal is actually born too quickly, and then the progesterones in the foal's brain, which are there to sort of keep it quiet when it's inside the mare, stay high instead of dropping, and they figured out that by squeezing the foal and sort of recreating the birthing process, you can actually stimulate those hormones to drop, and sort of effectively wake the foal up from this slightly confused, disorientated state. So that's a very clever sort of technique. And if we go on to the next, yeah, so this is and I think anyone who's worked with cattle probably knows how to put on the ropes. This is the same way as you rope a cow to pull them down, and then you gently pull on the ropes and sort of keep the foal still for 20 minutes. We sometimes use this as well if we're needing to give other treatments to the foal at that stage, but very simple technique. The only time you would need to be very cautious and probably not do it is if the foal has fractured ribs. But it's certainly something that your vet can probably talk you through, and these videos are on YouTube and it may be worth a try. I will say there are probably other reasons that foals can have this syndrome, which can be due to some infection in utero. We talked about infected placentas, or due to some brain damage from being stuck or being so the more severely affected foals who've been really starved of oxygen probably won't respond to this, and they probably will need more intensive care. But yeah, I just thought I'd mention squeezing because I know a lot of people have talked about, and yeah, you'll see lots of videos of that, and certainly worth a try for the majority of foals. Simple. So we do newborn foal checks on all of our foals between sort of 10 and 24 hours. And just the other things that we look out for, again, we just mentioned fractured ribs. They usually happen just behind the foal's elbow. If you imagine the way the foal's coming out of the mare, the elbow would be sort of squashed against the ribs. And that can be dangerous if they then sort of penetrate the heart. Rolled in eyelids, you can see here, and if those are left, you can get a nasty eye ulcer and infection. So this is one that Carmel fixed with some staples. And then just having a quick look at their gums, if you see them being sort of yellow or dull or muddy coloured, again, sort of something to give your vet a shout about. And the rolled in eyelids, now you can just kind of see under our video picture, basically this little guy actually was rolled in on both sides bilaterally. Normally I say to people, obviously, have a good look at the eyes, and if one is slightly different to the other, normally you would only get it on one side, thankfully. And yeah, you just have to pinch a bit of skin with either sutures or I tend to use staples now because I don't think they don't get as infected and goopy as the sutures do. Yeah, but it's an important one. Just have a good look at the eyes, make sure you can see a clean, the exact same as yourself, a clean bottom eyelid up against the eye, as opposed to this roll of skin and the hair is in the eye. It's very easy once you start seeing the tears stream down, but that usually does take 12 to 24 hours. So if you can spot it sooner and get us out the following morning, it's obviously much nicer for the foal, and you are definitely less likely to either get an ulcer or any other issues. Okay. So then we talked a bit about giving enemas to foals and trying to stop them having meconium retention. And again, most of the big farms I've worked on have done this routinely. You can buy these just cheaply from the chemist. How do you recognise this? You can see here this foal sort of straining with his back arched and flagging his tail. It often is overdue. Colts in particular can be more prone than fillies, but it can be any foal. But this is the classic sort of stance and behaviour. And sometimes they then get a bit of sort of trapped gas behind the meconium and they can get a little bit colicky. And again, any colicky foal, I'd advise you to give your vet a ring, but they may sort of say, well, try a second enema sort of while I'm be on my way and just see. So it's the most common cause of colic in foals. A less common cause, but could be confused with meconium impaction because they also strain, would be a ruptured bladder, and that can sometimes happen during a difficult foaling. So the classic thing with a ruptured bladder is that instead of arching their back, they're sort of dipping their back and straining. So you can see the difference in posture of these. And I'd be more worried about this as more of an emergency. And you can see on the ultrasound here, this is a nice normal intact bladder. Here's a bladder with a big hole in and it's got nothing in it, and all the urine is free in the foal's abdomen. So these foals can start to look a bit bloated and colicky and uncomfortable. And ultimately they can get sort of heart problems and things from all the electrolytes. So again, that is a one for your vet. So Carmel's going to talk us through a few of the limb issues that you might see in younger foals. Yeah, so often we can get what's on the left here, the extensor tendon laxity, and thankfully most of those will not require treatment other than potentially a little bit of help getting up and down. That side of things, we would
exercise is your friend with these guys, but unlike, now I realize this guy was taken out in order to take the picture, but you don't want to be moving them across hard ground like this, because their heels are right down on either concrete, be it stones, whatever it is, and you'll get little abrasions and soreness, and you don't want that. If the toes are pointing up like that, exercise within the box, and hopefully a nice big foaling box will be plenty to start with, unless they can walk directly out onto some grass and do some exercise on soft ground. Definitely not at this time of the year. Yeah, if you're foaling down obviously in April, May, and you're able to get them pretty much from the box straight out to the closest, smallest paddock, that will help tighten up all of these. There's no point panicking, I suppose, at this stage when they are lax like that and worrying about the conformation of your foal. The legs will be bending in every direction and all over the place, and we definitely can't assess anything. As long as the foal is getting up and down and doing all of its normal things for the first week, I wouldn't be too worried that they'll pull themselves together, strengthen up, often are a bit windswept as well, and we can assess them. Usually I tend to do like a conformational assessment at foal heat stage, so it's very handy for me. In most of the places that I'm working at, the foal is coming down towards the stocks to me, and I'll have a look as far as that's concerned and advise one way or the other. These other, on the right hand side, the flexural deformities, obviously if they're incredibly tight within the tendons and ligaments, these ones we definitely can treat. So there's an antibiotic called endomycin that helps break down the calcium channels within these and helps relax. Also, we tend to bandage them, as the heat itself will help also break down those calcium channels. A little bit of physio, if it's one leg, that's usually a bit easier than these guys, but again, helping them get up each time they'll get up. Not some of these foals, once they get up, because they really struggle to get up, once they get up, they don't want to get back down again. But it's really important for any of those foals can't sleep standing up. So when you see them literally in that hangdog position, trying to kind of sleep standing up, they're overtired, way overtired basically, and you need to gently put them down. Usually if you're on your own, the best method for this is to wrap your arms around the foal. If it's a smaller, like a 40-kilo foal or something, you can lift it from the chest and the bum and lay it down. You don't want to be slamming anything down on the ground. It isn't a rugby tackle we're after. Or otherwise, if they're the good 50, 60, 70-kilo big boys, again, put your hand around the front of the chest, and if you grab the opposite hind leg and pull that towards you, you can often make them sit down on that and then support the chest down as well. You'll usually get a few shin splints yourself for this effort, but putting them down and getting them up and helping them up will definitely help, because if the more exercise they do in these flexural deformities, the worse they'll become. So the tighter everything becomes, obviously the complete opposite to the left-hand side. So if they're standing for hours and hours and hours, all they're doing is tightening on these. So get us in as soon as possible, so the following morning, and usually 2 or 3 days worth of endomycin and bandaging, sometimes splints, sometimes casts, obviously depending on the severity. And infections, I think this was yours, was it? I don't know, maybe. I can't remember which way we were in. But obviously a foal with any sort of infection, these top pictures show you inflamed joints. It's really important, again, to know what's normal for your foal. So if your foal is up and about and doing everything that it should, have a look at its legs, have a look at its joints. Now this hock, there isn't many people going to miss this, but it could be half that size obviously when it's starting, and the foal is incredibly clever at being able to hide things till it can't anymore. So it might be just a hop skip and it's doing a little bounce around the box, and you're not really noticing that it's no longer using that hock until it obviously lies down and can't get up, and then you're like, oh, there might be something wrong with this. So on the bottom left-hand picture, you'll see a redness and little red dots throughout the gums. So the gums should only be salmon pink. Down closer to the teeth region, you can kind of see where the veins are going across, and that's a bit more normal. Towards if it's very red and little dots throughout it, they're petechiae, which is just more signs that it's potentially septic, and that there's a blood infection within that foal. Obviously, any of these scenarios basically where the foal is just not acting normally, or you're worried about a big joint, or there's a massive lameness. And I seem to get an awful lot of clients that kind of go, oh, I think the mare stood on the foal. That is actually incredibly rare. Don't get me wrong, there is some very ignorant mares out there, and they will stand on you, me, and the foal. But the majority of them don't. So if for one reason or another the foal has a big leg, definitely call us. If it's nothing to worry about, it'll be fine. You know what I mean? And we'll let you know. But getting us out again sooner rather than later is really important in these guys. Thankfully, a septic joint in the foals is easier to deal with than in adult horses, and usually a needle flush, obviously in surgery, will cure the problem. But yeah, absolutely, prevention is better than cure for everything, really.
Yeah, and you can probably do a needle flush in these if they're very fresh, but if they've been left for a few days and all the fluid gets so thick that it's a sort of job for the surgeon. Yeah. So I'm wondering, Wendy, should we just cover diarrhea while we're on infections, and then perhaps leave time for questions if we sort of leave going on to the older foal and just finish with the neonate? So,
yeah, I think so. We can do another session another day on the older foal, because we are at that time point now.
So really this was the last sort of slide relating to both infections and particularly young foals. Obviously there's also older foals can have diarrhea, but they tend to be a bit more resilient. But and sort of going back to the joint infections, it's actually really common for young foals less than a month, when they have diarrhea, that bacteria can get in through that sort of more leaky gut into their bloodstream, and the place that bacteria like to settle, I was describing it as a sort of U-bend in the joints. So again, and a young foal who goes off the suck can get dehydrated and low in blood sugar and weak very quickly. So they're much more likely to need sort of quick support and turnaround. So whether that's your vet stomach tubing them, or maybe actually giving them a drip. So again, a depressed, droopy looking sort of young foal who's scouring does need quite urgent attention, and if you get onto them quite quickly, you can hopefully turn them around and get them back on the suck. But and we talked earlier on about hygiene and things, but again, if there's a scouring foal, don't sort of think, oh well, I'll just finish with this one and then go and feed the next few mares and foals, and then I'll go and get a sort of some overalls or put a foot dip. I was like, straight away before you go around the rest of the yard, put a foot dip, put some gloves, wear some overalls, and just be super careful, because the only thing worse than one scouring foal is 10 scouring foals. And rotavirus would be one of the most common causes in young foals, and so you can vaccinate mares for that if they're resident with you. But it's very infectious, as are all the other things, sort of bacterial infections. So we just be super careful, and again, going back to the prevention being better than a yard full of sad scouring foals and also unhappy sleep deprived staff. So.
What you might do, ladies, is just push on to slide 29, onto the vaccinations, and just give a run through those, because obviously that is something that is quite important from the perspective of prevention.
Yeah, so rotavirus vaccine, and on the sort of big farms I've worked with over the years that have had a problem with rota, it's definitely been a really noticeable difference the following year when they have vaccinated the mares. But again, it sort of requires a bit of pre-planning, because they need an injection at months 8, 9 and 10 of the pregnancy. So if you just have mares kind of arriving into you just for foaling, it's hard to do that unless you can be in touch with those clients who are going to board the mares with you, or if they're your own mares living on your own place, then you can definitely do that. And it's reasonably expensive vaccine, but again, the 3 vaccines are probably less than one call out in the middle of the night to put a catheter in and drip a foal and then have to deal with that foal. So
and even if you are receiving mares for foaling, as long as they aren't like waxed up and about to go tomorrow, it's still beneficial to give the rotavirus vaccine. Anything will be better than nothing. Obviously, having the 3 will be ideal, and you will be as protected as you can possibly be. But if you're bringing a mare in and everything else is vaccinated and she's not, you're very much leaving that foal quite vulnerable, basically. So whatever little antibodies, and she might just, like they do, hang on 2 weeks or 3 weeks or otherwise, and if she's able to make any antibodies at all to protect that foal, that will be of benefit.
And then the other vaccinations that we like mares to have during pregnancy are the herpes virus vaccinations. So, and not only does that hopefully reduce the risk of the mare aborting, but it will also give that foal, as long as it gets the colostrum, some antibodies, and that can protect the foal for up to about the first 6 months from particularly respiratory disease. And although EHV4 can just cause a sort of a snotty nose and a high temperature in older foals after the sales, if younger foals get it, they can get really bad pneumonia and even die. And the same can apply to flu in young foals. And obviously tetanus we don't see very often nowadays, but that can certainly be fatal in young foals. So if you can give your mare her annual flu and tetanus booster sort of 4 to 6 weeks before she foals, then hopefully she'll put those antibodies into the colostrum and protect your foal for you for free for the next 6 months. And that's a better way of protecting the foal. So yeah, I'm saying not only as a condition of older foals, so perhaps talk about that on another occasion.
The clock is just going against us a tiny little bit, and I know that the intention had been as well to talk a little bit about dosing. There is a question here in terms of how soon after foaling do you recommend dosing mare?
I usually recommend dosing them before foaling. So ideally you don't want the mare wormy, you know what I mean, at foaling time or otherwise, or at any point. Ideally testing the mare to see whether she needs worming. So, you know what I mean, ideally doing a fecal worm egg count now a month before foaling or so, like that, to make absolutely sure. If you know your own stud farms, and I could go on with the next 4 slides as far as worming is concerned, but the main aim is to know what's going on in your own stud farm. So testing mares and foals later on down the line in order to know what you need to treat is the best way.
What I can suggest as well is that there was a previous webinar on this particular topic with Ursula Fogarty and Nikki Walsh, and there was a lot of information relayed in that as well, and people can look back on that. There's another question that's here, what disinfectant would you suggest? You can actually stop your screen share if you want there for the last few minutes just to tidy up, but what disinfectant would you suggest for a foaling unit? Whichever of you would like to take that.
We use Virkon.
Yeah. We'll agree on that one.
Yeah.
And I can tell you, we used Virkon 20 years ago. You know, it has stood the test of time.
To be a bit careful, bleach doesn't kill rotavirus. So yeah, that's it does kill Clostridia, but yeah, if you don't know what you might be dealing with, then Virkon's probably safe.
Is it a good idea to do rectal temperature checks on mares coming up to foaling time?
We check them all after foaling for the first 3 days to pick up any problems. Mare and foal twice a day for the first 3 days afterwards.
Yeah, beforehand it doesn't tend to. I think temperatures drop or something in dogs before. I think that's kind of sidelined or came in from dogs. So temperatures drop before a dog gives birth, basically. And I don't think so. I think if a mare, it would be so variable in mares as far as if they've literally just had either a fart or a poo, it could be a degree lower as far as that's concerned. So I don't think there's any scientific evidence to suggest that it'll either say when a mare is going to foal or be of any great help to you. If you think a mare is off grub, that's the biggest indicator as far as that they might have a temperature or that something is going on. But like Jennie said, absolutely whipping a temperature off them for 3 days after, so you're flagging anything that's going on is important.
And I suppose maybe, you know, to kind of wrap up at this stage in a way, you know, what management practices would you feel kind of carry the most weight or have the most impact in the sense of potentially preventing issues from arising?
Hygiene.
Yeah.
Number one, hygiene around the stocks, hygiene around the stocks area. So that is your high flow. Everything is coming through that area. There was a couple of stud farms that had swabbed their stocks, and I can't quite describe what was growing on there, but it definitely proved the point as far as that area needs to be clean. Every single mare and foal is generally coming through your stock. So a good protocol as far as cleaning that is concerned, because if it, like Jennie had said, if one foal has a diarrhea, and even if it's called like any of those, we would recommend coming into the stocks last, obviously, or doing anything with those last, as long as it isn't an emergency scenario. But there's no point her coming in last and somebody half firing a bucket of water on it and wandering off. Like, those stocks need to be properly cleaned, and that area needs to be properly cleaned. And it just goes across the board for foaling and everything else, basically. And if you have a scouring foal, not mucking it out straight away and dragging it across and throwing everything into the muck heap. I usually recommend either throwing lime down on the stable or Virconing the stable with everything in there. Leave that on for 24 hours. At least it will dampen down whatever is going on in there. Muck it out, ideally straight into a trailer that is then going away from the yard, so it isn't just mucked out into a pile on the yard, or a tractor is picking it up and traipsing across everywhere. So just keeping all of that in mind, that and then power hosing, letting it dry, disinfecting, letting it dry. So doing a quick power hose and a bit of lime down. I like lime down underneath straw and stuff. Sometimes you see it like lumps of it on the walls, and I'm always very worried about foals' eyes and everything else as far as that is concerned. But yeah.
I suppose you know, the whole period of COVID and what we've endured as humans over the last couple of years has taught us, you know, should have taught us, I guess, the role that hygiene has to play, the role, you know, that kind of stopping that transfer from one point to the next can play. And it's no different in the world of disease transfer with our equine buddies, whether they be ponies, horses, or, you know, the in-betweens.
Yeah, and isolating sort of scouring for sick horses, I know it can be very difficult to do when you're busy and heavily stocked at the peak of the season, but if you do have somewhere that you can put them that's just even a bit out of the way, where they're not in an American barn, a bit separate, that can really help. Yeah, you know, it can be easier said than done.
And I suppose the other aspect then, perhaps, you know, where there are those kind of yards where there's the sort of you know, shared enterprises where you've got breeding stock, and you also have perhaps competition stock or hunting stock or whatever they may be, animals that are going on and off the farm. That separation between the two is quite important as well.
Yeah, mixing on the hunting field and then coming back and living next to a pregnant mare is not the best idea if that can be avoided. Yeah.
And if you have breeding stock, like having everything, and you have breeding and competition stock, having everything vaccinated, because often people will vaccinate the mares, okay, but then everything's going off show jumping at the weekend and coming back, and although, as we know, vaccines are great, but they aren't the 100% that we would all absolutely love them to be. So they will help reduce infection, but it doesn't stop your yard being shut down with EHV or otherwise, you know what I mean? It came very close with, was it last year or the year before? The 2 years are a blur now with the Spanish EHV, basically. So we were very lucky that only a couple of cases, I think it made it back as far as the UK. A few of them had fled the scene before everything was locked down. But yeah, so vital to just protect everything you have on the yard.
Absolutely. Look at, ladies, you know, as I say, the clock is the biggest enemy on this series. Each time you've cracked an awful lot into the hour and a bit now at this stage. Is there any final piece of advice that both of you would like to share before we say goodnight?
Or
not.
I'd probably harp back to the hygiene. So having a reasonable set of overalls or waterproofs or whatever that, and not the overalls that have been hanging on the back of that door for the last 12 years and somebody grabs them out going, okay, now. So yeah, a little kind of disinfectant sachets. You can get the Virkon in now. You don't have to go out and buy the big expensive one. You can get like 10 sachets. And if you're just prepared, the minute you see something scouring or sick, snotty, something with a temperature, not normal little foal snots at the end of the year, but if something is genuinely ill with a temperature, immediately get the sachet, put it in the water, and have things prepared, because there's no point going off to the co-op at 3 o'clock the following day because you never got a chance. Like, it's everywhere by then.
And I think just being really observant as well, like we get, because of students from the agricultural colleges and vet students and things coming to work, and the more experienced staff are really great at teaching them to be sort of to look out for things. But I just say every pair of eyes that goes past, don't just go in and fill up the water and chuck in the hay. Like, every time you go in with a mare and a young foal, just have a really good look. Is the foal sucking? Is the mare's bag extra sort of too full? Is the foal moving sound around the box? Is the umbilicus dry? It only takes, when you get sort of tuned in, just cast your eye over them and just be looking out for things all the time and spot those things and talk to your vet about them.
That's a good point. And it's so possible to be observant without being intrusive. And yeah.
Well, it's just very much being present. So if you are going in there, that is part of your job too, and making that very much aware that is part of everybody's job on the yard. And likewise, I can't help myself walking past doors to just flick an eye. But when you get to know them, is that foal getting up? Like, if you walk past a foal sitting down on the ground, shove some hay in the corner, come back out, knock over a bucket of water, and that foal hasn't got off the ground, there's something wrong.
Exactly.
So yeah, if they're cute and fluffy and you're managing to pet them when you never had to touch them before, that's not a good thing. Generally.
Know what's normal and act when it's not. I think that's a very good place to leave it. So listen, ladies, I'm hugely appreciative to both of you, because I know it is really your busy time of the year. We very much played it safe tonight, having two of you on in case one got dragged to an emergency. So the hotlines are probably going in the background there. They're on silent. But listen, thanks so much for being with us here this evening. It's greatly appreciated. Just a note to our viewers here this evening, the next webinar is on Tuesday, April 5th. And I will be joined by Dr. Niamh Lewis, who is in UCD, and the topic for discussion is assisted reproductive technologies, the when, the how, and the why. So good night for now from Athenry and Galway, and mind yourselves and take care and enjoy the rest of those pancakes.
Thanks,
Will do.
Wendy. Thanks for
Cheers,
organising it.
Wendy.